Hello and welcome. Today, we're going to shed some light, pun intended, on one of the most common, yet maybe one of the most misunderstood procedures we do every day, light curing. It seems so routine, but getting it wrong can have some serious consequences for your work. Let's dig in and find out why.
So we've all been there, right? A composite restoration that looked absolutely perfect when the patient left the chair fails way sooner than it should. We know there's this huge gap between how long restorations last in those perfect, controlled clinical trials versus how they perform in our actual day-to-day practices. So what's going on?
Well, the culprit might just be hiding in plain sight. We're talking about your light curing unit, the LCU. It turns out that a general lack of understanding about how these things really work, and maybe more importantly, how to use them the right way, is a massive factor in why some restorations fail.
So in this explainer, we're going to demystify what can feel like a dark art. We'll look at the gap between the lab and the real world. We'll define the numbers that actually matter. And then we're going to walk through a really practical two-part solution: how to choose the right light and how to master your technique to deliver the right energy every single time.
Okay, so why do we call it a dark art? Well, because for a procedure that is the foundation for literally billions of dollars of dentistry, it is surrounded by a surprising amount of confusion. You see, a lot of the studies, a lot of the product sheets, they all focus on this one single and often pretty misleading number that just doesn't give us the whole story.
And this right here is the core of the problem. We tend to rely on the numbers that manufacturers give us, but here's the thing: those numbers can be really misleading. They tell us the irradiance right at the tip of the light, but that is not what the composite, sitting potentially several millimeters away, is actually getting. This gap in knowledge leads directly to undercured restorations.
To fix this, we really need to start speaking the right language. That one single number that we're all taught to look for, irradiance, is just one piece of a much, much bigger puzzle. So let's break down the three key metrics that you really need to understand.
First up, we have radiant power, and that's measured in milliwatts. This is simply the total amount of light energy coming out of that tip every second. The best way to think about it is like the raw horsepower of the LCU's engine. It's the foundation for everything else.
Next is irradiance, measured in milliwatts per square centimeter. Now this is the number we all know and see advertised, but it can be super deceptive. You see, a light can have really low total power, a weak engine, right? But it can still get a high irradiance number just by focusing that weak beam through a teeny tiny tip. So a high irradiance number does not automatically mean you have a powerful light.
And that brings us to the most important metric of all: radiant exposure, measured in joules per square centimeter. This is the total dose of energy delivered over the full time you're curing. It's simple: irradiance multiplied by time. This is the number that actually polymerizes the resin. Not just power, not just irradiance, but the total energy delivered over time. That's the whole shebang.
So, what happens when we actually test those manufacturer claims? Well, this chart shows some pretty dramatic results. Research found that half of the curing lights they tested were off from the manufacturer's claim by more than 10%, and some were off by over 50%. It's a crystal clear case of needing to trust but absolutely verify.
And it's not just about the numbers. It's about how that energy is spread out. On the left here, you see a beam with these intense hot spots and then really weak areas around them. On the right, you see a much more uniform, even beam. So which one would you trust to evenly cure a big molar restoration? That uneven beam is just asking for weak spots and premature failure.
Okay, so now that we've got the science down, let's get practical. How do we actually use this knowledge to make better choices in our own practice? Well, it all starts with choosing the right tool for the job. Here are 5 key things to think about. First, like we just saw, verify the claims. Don't just take their word for it. Second, understand the light spectrum. Is it a match for your composite materials? Third, look at the tip size and that beam uniformity. Is it actually going to cover your work? Fourth, check the ergonomics. Can you even get it where it needs to go? And finally, always prioritize total power over some flashy irradiance number.
So let's talk about spectrum for a second. A lot of modern composites use these alternative photoinitiators that are only activated by violet light, not just the traditional blue light. And as you can see here, a single peak blue LED light just won't cure those materials properly. You really need a multi-peak or polywave light to make sure you're getting a full cure across the widest range of materials out there.
In this slide,
Wow, this just perfectly illustrates why ergonomics are so important. I mean, a super powerful light is completely useless if you can't position the tip correctly. Just look at these examples. Some of these designs make it nearly impossible to get that perpendicular access to a posterior molar, especially if your patient has limited opening.
Now, choosing the right light, that's half the battle. But the other half, that's you. That's the operator. Because even with the absolute best equipment in the world, poor technique is going to lead to poor outcomes. So let's quickly review the essentials.
These 5 steps right here are totally non-negotiable. Always inspect your tip for junk and use a barrier. Protect your eyes and your patient's eyes. Position that tip as close and as perpendicular as you can. Then hold it rock steady for the entire cycle. Make sure you cover the entire restoration, even if you have to overlap exposures. And finally, know the required time for your material, but be ready to increase it to make up for any distance.
And remember, positioning is everything. Angling the light, even just a little bit, means a huge amount of energy is either missing the target completely or just reflecting away. You have to keep that tip stable and perpendicular to the surface you are trying to cure.
And here is exactly why distance is so critical. For most of these lights, moving just a few millimeters away can slash the energy that's reaching the composite. As this slide points out, a 50% drop in irradiance means you have to double your exposure time just to deliver the same total energy. That is a massive difference.
So after all of that, what's the single most important principle we need to remember when we pick up our curing light every day?
The research is absolutely clear on this. We have got to move beyond just looking at a single and often inaccurate irradiance value. It just doesn't tell us what we really need to know about the power, the spectrum, the beam profile, or the actual energy that's getting to that restoration.
Here is it. This is your ultimate goal. Your job is to deliver a sufficient dose of energy measured in joules using the correct wavelengths of light to the entire volume of the restoration. If you can just focus on achieving this one objective, I promise you are going to see a huge improvement in the quality and the longevity of your work.
Thank you for watching. Check out these QR codes for more information.